Hi, I'm Brenda Dahlman, and I'm here with Dr. Rudi Merck for Dr-Rudi.com. Dr. Rudi, I've been hearing so many advertisements on TV about opioid-induced constipation. I don't know if people know that much about it, and can you talk to me about it?
Yeah, for the past year and a half, 2 years, there's been, I live here in Florida, and there's been a lot of advertising for opioid-induced constipation. I call it OIC. And I was actually quite shocked that people that have pain medication, and these are legitimate things, because remember, the population of Florida is an aged population.
Exactly.
Baby boomers are now reaching 70 years old. I'm one of them. And then there are often things like cancer, joint surgery, general surgery, where opioids have been used, and opioids are, of course, very effective painkillers if they're administered properly. Unfortunately, we also have a lot of abuse of opioids in Florida. But here's the thing. Why would you want to take another drug with its whole set of side effects if you're already taking a drug which has side effects?
I agree.
Okay, so my recommendation is the following. While you're on a short-term use of opioids, it's okay to use chemical laxatives. I'm not a big fan of chemical laxatives, but you can also Google the whole issue of OIC and constipation, and you might be able to find some natural products that can help you alleviate the problem. Here's my general recommendation. Be careful about the intake of caffeine. Caffeine is a dehydrating material, and if you're dehydrated, it's less likely you're going to be going to the bathroom.
Makes sense.
You'll be peeing a lot, but you won't be having a normal bowel movement. And if possible, you should have one bowel movement a day. In worst case scenario, in my opinion, is one every other day. And then make sure you get some fiber in your diet. But the National Institutes of Health has said that fiber does not increase regularity. Well, guess what? They're wrong about that, because most people don't drink enough water when they take fiber. So there's products like Metamucil, which are okay to use, but don't use them in excess. If you do, you'll get fermentation in your colon, and you'll get gassing and bloating. So my recommendation is to take a fiber product that has insoluble fiber as well as soluble fiber. And there are several products on the market. There's nutritional bars that have a lot of fiber in them. There are foods you can eat with a lot of fiber in them. Pasta does not have a lot of fiber in it, folks. Potatoes actually have more fiber in them than pasta. Popcorn does not have a lot of fiber, so try to eat things like celery, berries, fruits that contain a lot of fiber. I don't recommend fruit in general, because oranges, pears, apples have fiber, but they also have a lot of calories and sugar in them. You're much better off eating blueberries, blackberries, raspberries. Figs have a lot of, figs is actually a flower, okay? Has a lot of fiber in it. And then take a chemical laxative if you need to, but just don't take it more than about a week. Long-term use of opioids is very dangerous, and it should only be used part-time. But you know, sometimes they just have to be used, and especially in an aging population.
That's great advice. I like the idea of eating as many fruits and vegetables as you can, and using natural as often as you can, but also that it's okay to use a prescription or an over-the-counter as if you need it.
Yeah, and Google natural laxatives, you can find them. Asparagus is another one, carrots, peas, but one of my favorites is figs.
Well, that's great advice. Thank you so much, Dr. Rudi.
Great, thank you.